Hi, Bijal. How are you?
I'm fine. How are you, Komal?
Good, good. So, tell us about yourself.
Okay, so I've been a pharmacist for about 25 years now. I've been in community, hospital, prison, and then now primary care. I'm an IP pharmacist since 7 years. So, yeah, in a nutshell, that's me.
Amazing, amazing. So, how did you come across us? Like, how did you come across our training?
Okay, this was quite, it was You know, they say when the time is right, you just reconnect with someone. So I just reconnected with Sunil on LinkedIn, someone who I went to university with. And that's it. That's how it started. And then he was telling me about how he's, you know, helping pharmacists, community pharmacists, all types of IP pharmacists to set up a dermatology clinic. It would so we were discussing that, and we had a few video calls, and he was giving me ideas, and I thought, oh, this sounds great, and I would really like to learn this. And dermatology was one area which I wasn't very competent at as an IP, so I thought, you know what, it's a good way of learning. So that's why I signed on.
Amazing. So, how did you feel about setting up your clinic before you did the training? And
I
how
didn't
do you
have a
feel now?
clue. I seriously did not have a clue. I was lost. I did not even know how to start, where to start. It's after the training, and thanks to you and Sunil, and even now, after setting up the clinic, that support that both of you are giving us. Anytime we're stuck, we just put the question in or share idea, and it's like the support. It's amazing. Continuous support.
Oh, thank you. Thank you so much. So, before you started, you didn't have a clinic at all.
No, no.
So, where are you now? What have you actually achieved since doing the training?
Okay, so where am I now? I set up my website, did a bit of marketing, connecting with local people, um, even offering a bit of, you know, it's like trust building with people as well. So it's working with your local network of people, people slowly trying to understand that, okay, you know what? Oh, maybe I should try her. But before they give me a go, it's that trust. It's like, okay, I think she knows what she's doing. They have that. They're like, okay, she's competent, or they have the confidence. So then, yeah. So I've started to see patients, and it's really rewarding. I think it's so nice that you can literally hold someone's hand and help them, and it's you feel good that I've actually touched a life and helped someone,
Yeah.
with something that they've been crying for. Like the other day, I had a mom, her daughter's got eczema, and she unfortunately missed the appointment with me, and she was really sorry, and I said, don't worry, had a chat with her, and she just offloaded because she had no one else to talk to and explain how she was feeling. So it's bridging that gap and providing that support. Yeah.
It's amazing. It's so amazing when you feel that, isn't it?
Yeah, it's wonderful. Yeah.
And what's your kind of niche area?
My niche area is eczema, rosacea, acne, and hyperpigmentation.
Amazing.
Yeah.
Amazing. And what's been the biggest impact of setting up your clinic on you? You touched upon it just now.
I wasn't confident. I didn't believe in myself. I was doubting, do I know this? Do I not? And as a pharmacist, you do know your products, you know the treatment plan, but it's actually putting everything together in a nice little box. Wait, and then you're like, yeah, I know that. I know how to treat eczema now. I'm confident. I know if a baby comes to me and it's crying and it's scratching, I know exactly what to do, because obviously with the training, you get the clinical training as well. And it's just so nice that you've been taught in a very easy way, but it's in a very in-depth way. I did not even understand the skin in so much depth that I do now. And that's my foundation to understanding why the condition happens.
Yeah.
Right, yeah.
Yeah. And it's just, being a specialist in one area,
Yeah.
I can see how much of a difference it's made for you, right?
Yeah, absolutely. Absolutely.
Because you can really impact patients.
Yeah. And it's skin. I've noticed skin is a very common, it's, so, skin conditions, skin issues are very common, and people are always looking for some sort of way. And, they think there's a quick fix. There isn't, but it's how you manage it. It's how you manage it and support that, work with the patient.
Yeah. Yeah. And what would you say to a community pharmacist IP like yourself who has a passion for dermatology? What would you say to them?
Simple. Get on board, get the training done with these guys. I'm saying it because I've done it and I'm going through the process. Please do not hesitate. You know what? People need us, patients need us.
Yeah. That's so true. Patients need us, don't they? Primary care dermatology is so needed.
Yes.
And,
Yes.
in the group that you were in, there's
Yes.
so many amazing specialist pharmacists now,
Yeah.
right? We've got one that's going to specialize in hyperpigmentation and in black skin,
Yeah.
right? It's just the possibilities are endless, right?
Yeah. And what is wonderful is, even if I'm stuck with a patient, I just tell the patient, okay, if you give me permission, I'm gonna discuss this with my team of professionals. I have a team, and we're gonna discuss this, and we're gonna come up with the best for you, the best treatment and management. That's what's wonderful.
Yes. That is the amazing thing about being part of the dermatology and pharmacy community as a result of coming on the training, right?
Yes.
Yeah, because we're building that network amongst us pharmacists, and you can refer to other pharmacists as well.
Yeah, that's it. That's it. So if I get a patient, for example, hyperpigmentation for in black skin, if I wouldn't know, I'll go, hold on, I know somebody who specializes in that. And it's wonderful to have this network and work together, and it's great learning. It's a learning, and life, we're always going to be learning, and it's just, you're just learning, and it's great to have that teamwork. I would say a good team.
Thank you so much, Bijal, for sharing your experience with us.
Yeah, and one more thing I must say, Komal and Sunil, I'm truly grateful, because you guys just you've held our hand, you're still holding our hand, and whenever we need you, you're there.
Oh,
That's what's
thank you.
really wonderful. So please appreciate that. Thank you.
Oh, it's an absolute pleasure. We absolutely love supporting you guys. And it's the reason why we created Forever Mountain. It's the reason why we run the trainings, and we want more IP pharmacists to develop their own clinics, and have that network around them, because we want to create a community around this. We've got some amazing plans in the pipeline. And, we just can't wait to be able to share these with you and, just hold your hand through that whole process and see you thrive. We want to see you thrive. And that's the most reward that we could ever ask for. Thank you, Bijal.
Thank you. No, thank you.
I'll see you soon.
Okay, bye.
Bye.
Bye.